Good afternoon or good morning, depending on the time zone you are on. We'll give people a few more minutes to get in and get connected to audio so they can hear and make sure everything is going all right. And we will get started here in like a minute or two here. Well, those that are joining us, we'll give people one more minute to join and be able to hear and get on audio. Hope everybody is having a good uh, morning, afternoon, depending on the time zone you are in. And we shall get started here in the next 1 minute or so. So looking forward to it and hope you're all looking forward to our class today from NNLM. All right. I will get started now. If people join, they will join and we will be fine. So, welcome to Health Statistics on the Web on July 29th, 2025. My name is David Brown, and I am a outreach and engagement specialist with Region 4 of the Network of the National Library of Medicine. And we will be talking about health statistics on the web today. Uh, just a couple of things to make sure that people that aren't familiar with Zoom or need a little bit of a refreshment. You do have the option to use chat and closed caption if you would like. Please try to chat to everyone, not just amongst people in the meeting, so that we all can see your questions. If you do have any questions, please type them in the box. As we go along, we will take time to address any questions that you have. I do have a technical support person from NNLM here, Molly, who she'll be monitoring things and making sure everything is going right while I'm speaking as we go along. Just so you know, the session is being recorded, so if you miss something or you need more, it will be posted on our YouTube playlist in about within a week, maybe quicker, maybe slower, but that's usually our lag on that. This also for this class, we are offering continuing education credits for both our Medical Library Association and for our continuing for our certified health education specialist as well. And at the very end, we will have a feedback opportunity. So your feedback does matter. Please fill out the evaluation at the end. We will provide that link, and it will be the only way you can get your credits as well. This session will be about 90 minutes. It's going to be trying to be interactive. We're not going to have a lot of math or anything. It's really just going to be looking at portals, looking at ideas, and seeing where we are as we go along here today. So, going on. First things first, I'm going to tell you about our organization as a whole. Basically, the network of the National Library of Medicine is broken up into 7 different regions across the United States. I'm from Region 4 and based at the University of Utah, Salt Lake City, Eccles Health Science Library. However, I do outreach and engagement from the state of Wyoming because, again, we have a subcontract there. And I do most of my outreach in Wyoming, North Dakota, and South Dakota. But we all do work within the 9-state region and are out there to work together and be out there to support IDEA. And basically, the mission of the NNLM is to advance the progress of medicine by improving the public and to improve public health by providing all U.S. health professionals with equal access to biomedical information. Because again, not every place is as urban or rural as other places. Some organizations have a lot of money they can put into finding health information, and others don't. So we try to equalize and level the playing field as best as possible, working through the National Library of Medicine, the world's largest biomedical library, and funded by the federal government. And the second part we try to do is improve the public's access to information to enable them to make informed decisions about their health. Again, we offer a number of resources. We have a number of training opportunities, such as today. There are some funding opportunities. And again, we are all out here. We are all working and we work in your local neighborhoods and communities. And we really want to know who you are and understand the people you serve and the populations you serve and how we can work with you and how you can work with us to really create some good collaborations and opportunities to work across everything that we do and to meet the missions of the program as a whole. So basically, we have 3 objectives today. First one is to recognize the differences between data sets, and statistics. Each one of those is a specific word and has a specific definition from a textbook perspective. And we will talk about that a little bit. Secondly, we want you to understand a 4-step process used to locate relevant health statistics for a particular circumstance or issue. And then the third piece is to identify some online resources that provide health statistics at the national, state, and local level, really trying to get you the opportunity to utilize the stuff, engage with it, and actually be able to use it in your day-to-day work or within your workflows or your work processes at your organizations or even in your personal life as you go along. There are PowerPoint slides. Molly will provide you with the online table and some guided handouts too throughout this idea. So again, all the materials are here, everything is there, and we'll make sure that you are receiving it as you go along. Like I say, all the materials are free, everything is here, and we want to make sure that you are getting the best experience possible with what we're doing and how we're working across these ideas in general. So, as an agenda in general, we're going to talk about statistics and from a more macro perspective, larger scale ideas, what we're trying to do as we go along. We're going to talk about some steps to find those health statistics. Knowing that they're out there and knowing where to find them are two different things. We'll talk a little bit about how we find them as we go along. We're going to do a little bit of a class exercise where you get to play a little bit and get an idea with it. I will then do some demonstrations of some of the resources there. And then we'll have a little bit of a exercise, and then we'll do some wrap-ups, have some time for questions and answers, and also provide you the opportunity to fill out your feedback links today so that we know how this class is going and if there's anything you would like to change or what you would like to see in future offerings from our organization. So let's just start out with these three things that I said, these three technical definitions. So data. Data is just raw numbers. It's those counts of individual events or services, and it can be collected at local, state, national, international, all levels, regional. It doesn't have to be just one thing. And again, we always are collecting data. Data is that low-hanging fruit that we see something, we watch something, we observe it, we get it, and it just becomes just a chart basically of where we're doing. Or in many respects, if we all use Microsoft Excel, we put everything into that Microsoft Excel spreadsheet, and it's just a bunch of data. It can be either numbers, it can be statements, it can be anything. Again, it's not really complex. It's just getting something there. It's just what we've gathered, what we've observed, and putting it in there. So then when we get a little bit further in there, we're going to create a set of data. Once we know that there's some interlocking things or some commonalities that we're trying to understand. So if we wanted to track the weather for the last 20 years in a certain area, that would be a data set because we would put what were the high temperatures, what was the low temperatures, what was the amount of precipitation that was out there. And you could really just have a large data set that you can use. And again, that's also true in the health world if we want to say, hey, what's been the trends that we've seen with cancer over the last 20 years? Again, these are just large data sets, large things that we can use, and really it's that major unit of data storage and retrieval, data collected and organized according to a criteria. So it's actually organized. It's like, what are we specifically looking at? What are we trying to do? Taking all that raw numbers and actually making it usable for something that can be usable for the public, for government, for anybody as we go along. And the one thing we have to be sort of cautious about, it may or may not represent the entire population, depending where it was gathered, how it was gathered, what the inclusion criteria were, what the exclusionary criteria were. Again, all these things that we look at that we have to understand that, not all data and not all data sets are created equal, as we've seen and we will continue to see in time. And then the last thing is the statistics is that's when we take that data set and we actually analyze it and say, what is it showing? Are there trends here? What do we know about it? How are we doing it? What does it mean? What are we seeing? What are the trends? What are the changes we've seen? Is there something significant there? Is it not? In general, most data on websites are compiled as statistics. Again, we don't just usually produce raw data or give raw data. We do an analysis and say 50% of America is experiencing overweight or obesity. Just some, general numbers that we throw out there as we go along. And usually it's presented as a percentage, graph, table, map, some way that it's more of an infographic, not just raw data, raw numbers out there. It's actually put in a way that does it. But I will just say that not all statistics are truly truthful because it goes back to that thing I was saying about every data set, who was included, who was excluded in that, because that can really have some bias on the statistics you see as you go along. So what are some key features of our health statistics? It's a numerical summary of our data compounded on computed on samples. Again, we know what people are doing. We know that people are diagnosed with a certain disease. We can look at different things, what may have caused that, where it came from, all those things to really get down to those areas. It really tries to characterize the health of the population and the influences that affect their health. So really looking at the social determinants of health, really looking at why may this be, why might not this be? Is it because there's a food, if we're looking at obesity things, is it because there's a food desert? Is there not access to safe walking trails and bike paths and parks? Again, what's going on there? So we can really look at what's happening based on those ideas. The parameters are the values that describe characteristic of the population. So again, there's always population parameters of, okay, what are we doing? Are we looking at a population that's older? Are we looking at a population that's younger? Are we looking at a population that's underrepresented or that is a majority population? Just looking at these things as we look at and we work across it. It's often collected and analyzed over a time period. Again, most of our studies are usually just quick, what's happening within the last 3, 6 months or a year. We can also, just don't think that we can also look at historical data by doing a retrospective study, and we can also do cohort studies where we're going to follow a group for 5, 10, 15, even 20 years as we go along. Again, those are just some of the different ways you can set up your statistics, work across that, and really understand where we're going as we go along. And basically, the thing you always have to remember is most of these data and statistics and all are collected to meet the needs of the collector. So again, we're going to be collecting data at the end of this session based on your perceptions and what's happening. And why are we doing that? Because our funder says we need to tell people what's doing. So we're doing it to meet the standards of our funders. Again, and we have to always remember that maybe we want to get other data, but sometimes we have to ask specific questions because we're being told that we have to do that. And there's not much we can do about that, but we can always try to expand and extrapolate on it as we go along. So. Before I go on, any questions on any of this? I know it's going quick, but I'm not trying to be too overbearing. But if there are questions, please feel free to type them in chat or let me know as we go along. Because like I say, I don't want to make it go too quick, but I also don't want to overkill this because this is it's important, but it's not the most important things. All right, I will continue on then. What are the uses of our health statistics? It's to provide information about the health of the population and what influences it. So again, going back to what I was saying before, is that everything can be, used for our benefit many times. We're trying to monitor health status and risk factors. We want to guide our research policy and program development. We want to evaluate research policy and program effectiveness. So again, being that this is usually more of a public health audience, we think of it as how are we going to improve the health outcomes of our specific population or our specific community. And really, that's what we try to use these statistics for, to just say, hey, there's a need here. It's an unmet need. So we need to create a program, or, we're seeing changes here. Maybe we have to inform policymakers on how to go with it. And it really does help us understand what's going on. And really gives us sort of that baseline understanding of what's happening and where we're trying to go and what we're trying to do as we look at and move forward as we go on. Okay, Vicky, I can address that question at the end, but we can definitely talk about what's sort of happening in the administration. But please fully realize that I am a federally funded individual, so I can't really get into some of the weeds on it, but I can give you just sort of a general opinion on what's going on from our organization and where we're going. But I'll definitely address that at the end. All right, so we have all this background, all that. So now, how do we find these things? What are we trying to do, and how do we do? First thing is always we have to formulate a research question, and again, what is that question? It could be as simple as, what percentage of children are receiving the MMR vaccine in New York City? I mean, you could really just have any question there and you can get these data. You can also look at, what percentage of children are on supplemental nutrition or CHIP. Again, all these things are information you can find. Based on that question, then you have to choose that right resource because there's a lot of resources out there, We're going to go over a few, and by no means is what I'm going to provide today exhaustive or complete, but they're usually ones that at least get you a general idea of where we're going to go. We then evaluate the results. So what do we see? Are there trends here? Are there not? Are there conflicts? What's making the data there going this way or that way as we go along? And then we're going to always repeat this because again, data changes, new data is updated, new resources are produced, new studies are completed. So again, we're going to repeat it and see if there's any change. If there's no change, what have we changed policy wise? How are all these things affecting it or not affecting it? What's going on? So we can make more informed decisions as we go along and as we work across these ideas. So, what I would like you to do here is take a couple of minutes, to formulate a question for a health statistic you are interested in finding today. You may want to include age, where they are in terms of geography, time frame, anything like that. So again, it can be as specific or as general as possible. I don't care. Some examples I have here is what percentage of adults age 21 or over reported having coronary heart disease in Kentucky in 2023, or how has the rural urban distribution of the geriatric patient population in the United States changed over the last decade? So again, general questions, thoughts there. You can write it down. You don't have to type it in chat or anything, but just do it for yourself. I'll give you a minute and a half here or 2 minutes here to think about that and write it down because we are going to address part two of this. We'll actually get into actually you finding this data after I do some demonstrations and give you some ideas as we go along. So I'll give you another minute to 2 minutes here before we are moving forward. And if you do have any questions, you can first, and I see here about the topic page. Again, we sometimes we don't we don't update that's okay. All right. So hopefully you have had an opportunity to come up with a question and think about it, and we will now get into our statistics portals as we go along here. So, first one I'm going to demonstrate here is our National Center for Health Statistics. I will pull it up. I'm going to stop sharing here and I'm going to share it over on my other thing here as we go along. All right, so I'm going to go over to sharing. All right. So if we go to okay. We go over to the National Center for Health Statistics, which is cdc.gov/NCHS/index. You will get to a website here that's just going to have information there. Basically, this is the one from the CDC. It's been there since 1987. There's a lot of data here. It's a lot of material. It might not be being updated as quickly as we want it to be updated, but definitely it is out there. It is quality data, at least historically, and we do rely on it pretty strongly as we go along. And we will continue here. So again, here, there's two things that we can look at. There's the surveys and vital systems. So if we look at our surveys and vital system, these are all the surveys that are controlled here. So again, we have NHANES, we have a number of things. This isn't the data, but this at least gives you an idea of what's there. So if you want to learn more about it and when it's been collected, what the sort of the history on these are, different approaches. And really, it is a good place to look and get some ideas. I know I'm going quickly, but I'm not going to read these, but you can spend your time looking at this as you go along. There's a lot of different things, things here, lots of good information. And again, specifically on what question you're looking for, you will find it. Now, where I do like to go is to our data analysis and tools. There's a lot of things here, but the one we're going to look at is our interactive data resources that are here for our dashboards. And we are going to go down to interactive rapid survey system estimates. So this is, oh no, we're going to go, I'm sorry, we're going to go to the National Center for Health Statistics Data Query System. So this is going to be a way to query what's in there. And again, you have to click a few things to get there, but we access it here. So depending on our topics that we are interested in as we go along, we will definitely use different ways to do this. So again, we will look at different ideas here. So we will look at that. So again, depending on the diagnosis that or whatever you want to do, lots of topics here, but oh, shoot. We have a lot of different topics. So again, we can look at asthma, we can look at attention deficit disorder, birth rates, lots and lots of things. But let's just take one today for hypothetical ideas. We can look at, kind of fun here. Specifically, and like I say, we can just look at an idea of how long people are staying in the hospital across the ideas. So this is just a very general idea by total groups. So again, we see in 1975 the average stay was about 11.4 days, and now in 2020 the latest data it was down to 6.3 days. Now again, we don't know if this has changed because the pandemic has not been included in this data, but there is different ways that we can look at it. Now we can also do some different groups. So if it was public or private, if it was a federal hospital, again, we can add more data in here to really get some good policy understanding of what's going on. We can also remove things. So if we're just looking at, we can, as you see here, we have sidebars here. We can take it. So we just want to see what's going on in the federal government. We can also add more back in. So if we want to just look like at a community hospital versus a for-profit hospital, you can see how things have changed and just understand where things are going. Other thing you can also do is you can put it in tables, in table view. So that also is a way to look at it. If you want to look at it from more of a raw data point of view, if the chart doesn't make as much sense, it's a good way to look at it. You can also look at dates anywhere from 1975. So if you want to look within a date range, for example, so if you want to say you want to look from the last 20 years that was done, so from 2000 to 2020, you can see it that way and see what's going on, and also in table format as you go along. And then you can say, wait, I'm not going to have it. So like I say, it is a different way of looking at it. It's a very useful way of doing at it, and you can do it. And like I say, there's many things just depending on the question you're looking at. If you want to get some data, lots and lots of places to look at it. It's very useful. It's a nice way of just looking at it, but please realize that not everything's going to be the most current. I mean, we're already in basically 2025, the middle of the year. So some of this stuff may be a little dated at times, and we really just have to see where things are going and what's going on as you go along. So that's one of our portals that we will look at. The second portal we will look at is our Medline Plus here. And what's nice about Medline Plus is this is our National Library of Medicine consumer health portal. It is very useful. Again, it is being updated, it is being monitored, and we are trying to keep it as current as possible, fully realizing that things aren't there. There's always usually a featured health topic here. And there's also just different ways of health topics, medical and genetics, drugs and supplements, medical tests, and health recipes. Now, if you're specifically looking for a health for statistics, we usually go to the health topics here. that we look at. And like I say, everything is here that we look at. And again, depending on you can have health topics A to Z, and you can also do it by location. But if, for example, if we want to look at breast cancer, we could go to the topics here, A to Z, maybe. It's going to load. Always when we're doing a demonstration, it's going to be slow, but that's okay. It will hopefully do what I'm asking it to do. Hmm, Jeez. All right. As we were able to get it to work, uh, so if we want to use breast cancer, for example, we can go down to uh, breast cancer. And basically, we can get some summary data. Everything is here. But if we're really looking for the statistics, if we go down to research here, you'll see statistics and research, and it will give you specific places where it came from. Most of this is going to be referenced back to NIH, the National Cancer Institute, or other places. And again, right here from CDC, there's all the breast cancer statistics. Again, all these resources are here. We feel that they're vetted and they're current right now, so that's why we link to them. And again, they are just a good way to just get some general information. Maybe just specifically if you're trying to give resources to community members or others that may not have a health background, it's a great place to go because this is our consumer health side. It really does help you understand where you're going, and you can really do find what you want. And like I say, if we go over to the breast cancer statistics from CDC, it will just take you there, and it can put it into the visualizations. Again, going beyond where we're going. But like I say, that's just one way to look at it and find it as we look at it as we go along. So another resource from our CDC colleagues is our Behavioral Risk Factors Surveillance System, or BRFSS, which is again been around for a number of times. It's a lot of interviews as you want to look. What's nice here is if you're there, if you don't know what's in the questionnaires, you can first look at the questionnaires here by year, by English. And again, the latest data that was published was in 2023. So again, those are the questions that were asked. So again, it goes all the way back to 1984. So if you do want to see the questions, you can click on it. It'll pull it up as a PDF document. It will tell you what questions were asked that year, how it was asked. It's a very long code book, but it's definitely a place you can look if you're specifically looking for doing a larger data set or some secondary analysis. You'll understand how they asked the questions, where it came from, what we do. So again, it's a good place to look. It's a good place to start. And usually there's a 2 to 3 year lag on when stuff is published because it takes a while to analyze and look at, but it is out there. It is as we go along. And then again, if you want to specifically look at some data, which is basically what we're trying to do here. Oh, one thing I forgot on the questionnaires here is there are state-specific modules. So again, depending on the year, there's a state by data set. So again, some states do choose, they want to ask specific questions that they think are of their interest, so you can get some more specific things on your specific state. Not all states participate, but it is a good way to look at it and figure it out as you go along. A good resource, a good way to look at things, and it's kind of fun to do and work as you go along. So if we go to the data analysis tool, what we do like to use here is our prevalence and trends data over here on the left. There are more things here, but it is this is sort of our base idea. So again, we can select the data set. We can either look at nationwide or by major metropolitan statistical areas. Again, sometimes we want to look at urban centers, and that's why they break it down by MMSAs. But for today, we'll just do some nationwide. And let's, for example, take the state of Kentucky, and we want to look at alcohol consumptions, just hypothetically. And then we can look at alcohol consumption, binge drinking, chronic drinking, or heavy drinking. It breaks it down. So we'll just do general alcohol consumption. And we can select the years. So we can do the most recent of 2022. And then it's going to give you specific questions that were asked. So adults who have had at least one drink of alcohol within the past 30 days. Now, again, it might not be perfect, but it will give it there. We'll get some results here. And again, it'll take a minute because it's government and it likes to be slow. It will look at the overall. Overall, you can then break it down by sex if you want. If you're looking at male versus female, it does take some time sometimes and um, to load these, and it's working. Just on its idea of how many are doing it, how many are not, and then there's the table view too, that which I do like because it tells you how many people answered the question, what the percentage was, and what the confidence interval is. Again, we won't go into that, but that really just shows you how many of the people are you for sure within 95% are within that area as we looked at. So again, you can do it, break it down by sex, you can break it down by age group, which may be interesting. Is it that older adults or younger adults are drinking more? Sorry, it's a little slow, but it is the government. We all know that everything is being updated, and as you see, it's the way it falls out. Again, this is just by in that idea. You can also do by race and ethnicity, education. I'm not going to break it down to all of them, but I'll just show you one more because I don't want it to keep constantly calculating for 15 to 30 seconds. But yes, so again, in this case, it shows what group is not and where it is, at least in the three groups they were uh, uh, categorizing here. So again, good way to look at it. And like I say, all of it is just good ways to look at it. It breaks it down by demographics. You can then change the years if you want. You can do a lot of different things. It's good as you know. And then, okay, so that was explore by location. You can also explore specifically by topic. So if you want to look at fruit and vegetables, and you want to see how much vegetable consumption individuals are having. Latest data on this is 2021. And their question is consumed vegetables less than one time per day. So this is going to be a negative one. You got to read what the question said. So that's the other thing. It's just because it's there, but this is going to be people who say they aren't eating vegetables as they look at it. Um, and it will just give us a overall, and this can be a nationwide idea. You can also break it down if you want. And again, here's a map that are not eating it, and which states are the worst, which states are the best, and some states that didn't provide data as you look at it. But like I say, it makes it a nice map. You can also oh no, that was the one or more times per day. So again, this is the better health indicator. You can also do the less than one time or more times per day percentage. So again, it is all here. Just good ideas. You can look at it as a chart as well, may or may not make as much sense. And you can also look at it as a table in general. So just a different ways of looking at it, different ways of visualizing your data. And just a good tool that I like because, like I say, it's very usable. It is. I do know most of this data is current and up to date, at least from the last few gatherings, because it wasn't during this current administration. So again, good resources. May be a little dated, but again, it's some data. It gives you some ideas. It's a way to really look at it and understand what you're doing and how you're looking at it as you go along. So next we will talk about our state health facts. So this is from the Kaiser Family Foundation, a nonprofit organization that really looks at health across a lot of different ideas. What's nice here is you can enter some keywords if you have a specific keyword you want, which is 800 keywords that you can type, or you can specifically look at things that you want that you're interested in, and it breaks it down. So if we look at Medicaid and CHIP usage, we can look at this specifically if we want to look at enrollment, and we can look at monthly child enrollment in Medicaid and CHIP. And this will be as of April 2025. This is very current data. It shows how many are enrolled that are children, the medical CHIP, and child percentage is a percent of the total. And you can break it down by state and also break it down by raw numbers if you want to see it, which states are the leading, which states are the fewest. So same with the total enrollment. And then the percentage that of the children enrollment is a percentage to the total Medicaid, so the highest to the lowest. Again, just depending what you're looking for, it's definitely a way of doing it. I can say you can also limit it. So if you want to just look at the state of Montana, it will put the notes there that you want to look at. If you look at it, and this again, it tells you what it is. There's the United States as a whole. Or if you just want to do a couple states, say Nevada, California, Washington, and Oregon, for example. Let's use some of our uh, um, friends there, and then it'll just break it down because you can do it regionally as you look at it, and it will just tell you what's going on, how it's working, and where it is if you want to do it more regional. It's a very useful tool. Again, there's a lot of different ways to do it. You can look at it as a map as well of where it is, and then also the trends. See, they're following trends. So where are we seeing? What's happening? Is it going up? Is it going down? As time goes along and looking at enrollments versus not. And again, some places aren't going to necessarily have the most current data and others will. So like I say, you can just look at the trends here and see what you've got. Just a lot of different ways of looking at it, understanding where it is. And again, just depending on what you're looking at. A lot of it's just going to depend on your ideas. If you also want to just limit it to like the last 5 years, you can do that as well. You can go to July of 2020 to April 2025, you're getting a little bit more picture here. Again, depending on what you're looking for, you can get all this data, you can get all these stats. It's definitely a way of looking at it and understanding it as you go along in general. So, any other questions that we are interested in? And I'll go back here. All right. Let me see. I'll review any of the early questions here. Just, yeah, yeah. What are the questions you wrote? Uh, let's see. Got the CC. Uh, First one about stable link with set. With most of that, it's basically in your queries. You're not going to have the raw data, so it's going to be that you're going to just download it as you go along. And then you got another question. So again, I think we're doing okay. If there are any questions, please let me know. I just will give you an opportunity to think about it. I know I'm moving along here, but I do want you to have some opportunity to play with your stuff as well. Okay. We will then move on to our Census Bureau data. Again, what's nice about the Census Bureau is it is gathered every 10 years. Only thing is it doesn't necessarily always have everything that we want because it's not going to just be health statistics that are out there as we go along. But again, it's nice because it's actually broken down by census tract. So again, if you want to get a little bit more local and more specific on your areas, you can really look at it. It is our federal government's largest statistical agencies. You know, it's about our America's peoples, places in our economy. And what's nice is it goes states, county, city, town, zip code, even census tract or congressional districts, tribal area. Like I say, a lot of good quality information. The only thing is it's not necessarily just focused on health. And maybe some of the health questions may or may not be what you're looking for. So again, there are some other surveys available, such as our community study, what's going on in our population, a survey of income and program participation. You know, it's been redesigned. Uh, so, so if we want to specifically look at an example here, we can go. So we can type in here. So let's just look at Pittsburgh in Pennsylvania. Thank you. I was looking right, and then so if we're going to look at the city of Pittsburgh in Pennsylvania, we can then also say we want to then look at specifically poverty, we can. Yeah, see what it'll do. I might have to do it advanced, but we'll see. Sometimes things. So, there's a specific idea here is from, and this will come from our American Community Survey. So again, poverty status in the last 12 months. And this is specifically to the uh, the city of Pittsburgh. We can definitely look at it. And it's all estimated by age. It's a good way of looking at it. Good way of just looking at some of our health status. What's going on, where are we, understanding where it is. There are some notes that are here, so we'll understand where it is. It tells you what year it came from, 2023, what the table was. It gives you everything that's there. It will give you the geographic ideas, the topics, the codes that they use, the data set specifically, and by year you can change years. And it does work as you go on. So like I say, it is just a way of looking at it. It's useful, may not be the most useful for health, but it's definitely another tool that you can go, especially if you're not having any luck finding something, or you need a more general idea, or you're trying to do more general search or general literature search. This is a good place to go. It's a good place to look and get it and understand. You can then see the maps, which is nice. It will map it for you. Um, and of course, there's no data for 2023 here. Let's see if I go back to a different year. So here, if we went back a year, and it will show us here sort of where it is, and it's basically showing 19% as a whole by map. It doesn't do it, it's not breaking it down much further, but this is just a different way you can look at it as you go along. There are charts as well that are going to show, trends of where it's gone. You can change the chart type as well. Uh, Then we can do other filters as well. I mean, like I say, just a different way of putting it, making it, letting it go. You can look at your profiles as well. Again, and then any additional pages that you want. Like I say, a lot of good resources here, just a different way of doing it. And you can do it. You can also do advanced search. So if there's something specifically you want to do, you can definitely look and see what you want to do. If you want to break it down by census tract, if you want to break it down by years, any other codes. So like I say, that's another way to do it. It doesn't have to just be using the general search box. You can go into advanced, which is very helpful for people looking for more specific ideas or knowing what they're looking for at that time. So good resource, good way to look at things, and definitely a good way to look at things and make things work as we go along here. And Sarah, about transgender, I don't know. I mean, I can see. Let me see if I get anything here. We can always try this. See what it if anything. Nope, except for if I misspell it. Nope, I need to do it. And like I say, and that may be going to be more of a problem with our federal data set. We can try some other stuff as we go along. I will think about that as we go forward. So that's another federal government resource. Now we're going to go to some more of our local and others that you may want to look at. Is our county health rankings. So again, depending on what county we're looking at, it's nice here as this is broken down by the county level specifically. And this is a good way of looking at things. So if we want to look at the state of Washington, for example, here, so we can just type in Washington. Uh, and we hit search. So this is, what's nice here is you can actually download the data sets. if you want them, which is nice that it's not, it's actually the raw data. So if you would like to play with it or look at it, you can do it. And this is 2025 data. So this is looking at least from their indicators, what are the most and least healthy counties in there based on what's happening in the state. So again, the darker the green, the more healthier, the lighter the green, the less healthier. Can also, if you want to look at congressional districts, it will break it down by congressional district lines if you want. As you look at, you can remove the cities. And then if you want to, if you're just looking at a specific district, it'll show you Sanchez, the sixth congressional district, gives you an idea of where you're looking at. You can also remove that. You can also take the cities out or leave them in. Just depends what you're looking at as you want to look. So we can show some demographic data. It says what the population is, what they are in general. Again, as you see here, there isn't anything that really is broken down. All they're saying is female. There's not a lot on other genders being represented, and that's again of what they collected. Again, we can look at lifespan. So as we go along. So we look at it. We got quality of life. We can look at, poor physical health days was, these are trends. Let's see, looking at here. So basically, 6,800 years of life were lost due to per 100,000. Again, better than the 8,400 average. And then it will show what the map of premature death within the state, which is great. It just shows you where it is. And what I like here too is it's very useful because actually you hover over it, it gives you the data. It doesn't, you can look specifically at county. You're not idea. You can look at more data for that. You can look at more data specifically. It really does a good job of being a little more user friendly than our government. But again, there's always, who's doing it. I mean, again, we trust it, but you always have to think that it isn't necessarily backed by the government, which may or may not be at this time what we want to see. But again, it is definitely looking at what's going on. And again, you can just see the health stats here that they're using. What's going on in the physical environment, what's going on, in terms of education, unemployment rates, all sorts of things that may or may not be directly related to health, but definitely have an impact on our social determinants of health in general. So again, these are just good ideas to use. It really looks at those counties, areas, and you can get more data on specific county if you want. If you just want more data specifically for King County, it breaks it down even further. If you also want to, and like I say, you can look at trends too, all the way back to 2011. You can also, here, if you want more data for population health and well-being in general, where we're looking, you can look at community conditions, social, all of these things are there. That gives you at least some additional resource that you can have and use and understand and explain where you've gotten your material and how you're using your material in general. Allison, I am not sure if it can be embedded. That's, a question that I am not sure of, but definitely something you could potentially look into because they do have their terms of use as well as their FAQs. So again, there is just different ways of looking at it as we go along. All right, so hopefully that's a good, useful resource for all of you. The next thing we can do is specifically on cities, fully realizing that, not sometimes we want to just know a city. This happens to be better for more urban centers than local centers or rural areas. But it's a good idea. This was created by the Department of Population Health at the School of Public Service at NYU. Over 40 measures of health for over 900 cities, which is again good. Data at the city, zip code, and census level tracks, and measures align with county health rankings and roadmaps. So, looking at what we're looking at here, it's the 500 largest cities. So again, is there any specific city somebody would like to dig into or know more about? I can definitely type it in here. Somebody has a city they're interested in or curious about? Des Moines, Iowa. I'll take Des Moines first. That was the first one that came in, maybe. All right, so Des Moines, Iowa, we will go there. So then they have all these metrics here. So again, depending what you're looking at. So if we want to just take, for example, smoking, I mean, this is the one that's, again, the latest data is 2022, so it might be a little ideas. So again, we look at it, we're looking at, they're saying, and what I like here is it explains lower values indicate better outcomes, higher isn't. And again, the national average is 14, but in Des Moines, it's 17.5% of adults were reporting smoking. So not the best. Then you can look at where it is highest and what census tract or city or area idea is. So again, it can maybe be a way of focusing on where you want to do some of your smoking cessation projects as you look at it. We can then look at some. You can download these maps, which is again good way of if you want to embed it and also share it. So again, there is different ways of sharing this. You can also look at all dashboards and city values. You can look at some more details. This one doesn't have it. You can also compare cities. So if you want to, compare Des Moines, Iowa to let's just say like Chicago, Illinois, uh, two bigger Midwestern cities, and you'll see Chicago's more closer to the average versus that. You can show where you're leading, where you're not. Just a different way as you look at it. You can also compare your metrics here. You can change your metrics. You can add another metric in if you want. I mean, there's a lot of different ways you can display this data. So it is a good idea. One thing I do like about this is it a way of taking action, specifically looking for your partners out there, where you may be able to find some funding. What are some policies? What may be some of your partners? What are some of the strategies you can do, and how you're going to measure your impact? So it's a good little resource here that you can use. You can then look at some of those highlights here uh, that are going on across. It's not necessarily just in Des Moines, but there's just a lot of resources here. Um, Looking at what you're looking as you go along. So, and then like I say, here's just an overview of all the metrics there, where they're on track, where they're below, which is better, where they're above as well. So, like I say, everything is here. It's just a good way of looking at it, and you can definitely look at different things and have an idea of where it is. Sometimes you want the higher values, sometimes you want the lower values, just depending what it is. And that's what I do like is at least tells you it tells you the higher values indicate a better outcome, which is great as you look. So like I say, depending what you are looking for, it's just a different way of looking at it. It's a fun way of playing. It's a good way of just using your ideas and seeing what you want to do, at least for a more urban center. Now, just as we know that there are urban centers, there are rural and frontier communities as well, which again is at least what Region 4 tends to serve a few more ideas as we look at. So our Rural Health Information Hub is one of our preferred ideas specifically uh, for our rural health information, and specifically here it is. We will continue. So, like I say, it's a very good resource that we look. So, and then this is this is funded by the Federal Office of Rural Health Policy. It's a national clearinghouse on our rural health issues. Statistics are for our metro and non-metro counties on demographics, health disparities, social determinants of health, and access to services. So, I'll do a short demo here. As we go along here. So what's nice here is they have this thing called rural data visualizations. So what you have here is you can have your rural data explorer, you have your chart gallery, and you have your maps. What's nice here is there's also topic guides and state guides specifically. But if we look at our rural data explorer here, It just shows you what's going on here in general, where people are living um, as a percentage, what's going on in terms of poverty, what's going on, all these things. So we can change it here to anything you really want to know. So if we want to look at low access to healthy food, again, the latest data is 2019, but we can also just look in the state of, use my state of Wyoming. It will just show you where people are, where the low access to healthy food is, as you see it here. It's just another way to use it, understanding where it is, where some of the counties are worse and better in that idea. So depending on where you are, you can definitely look at it and make it understandable and make it work for your ideas and what you're trying to do in general. So good resources overall. I say they're just different ways to do it. You can also, like I say, they have their chart galleries by topic or by state. So you can look at Colorado, for example. It makes a chart for you. It has the charts here. It shows you what's going on. It's just good resources that you can use and understand. And also they have maps that you can do by health status, the health workforce, and the healthcare facility. So um, you want to look at disabilities by disability status. Again, just a lot of good resources here, good places to think about, good resources in general that we can use. Just good overall materials that we are using as we go along here. So I will stop sharing for a minute and I'll go back to my slides, but any questions before I go on or are we? The data comes from on the City Health dashboard site. That is in conjunction with the with the county and with the county ones, and also any other data that may be provided by the city as well. All right. Any other questions here? And I'll go back to my slides here so we can give you some time to play around a little bit. All right, so that was our RHI hub. I'm sorry, City Health. One thing, another resource that's out there that's been done by one of our other regions is specifically on National Neighborhood Data Archive. So again, this is another thing where you can look at how your neighborhood cognitive health through places to be physically active, socially engaged, and keep your mind active, and the other data repository for open data for research questions that describe place. So specifically looking at social determinants of health, crime rates, police districts, polluting sites, and public transit. So again, just different ways. I'm not going to demonstrate this one because it's another one that's out there, but I'm going to say there's lots of resources out there. Sometimes you're going to have to dig around and see what's most appropriate, make sure it works within it, but we are definitely there as you go through and as you look across the idea. So I stopped for questions already. So now we're going to take our last piece of this for our class exercise. I'll give you a little bit more time since we moved. Use the question you formulated in part one to explore steps 2 through 4 of the 4 steps for locating your health statistics. And then you can perform a search for your question. Take some notes on what you find. So step 2 is going to be choose the best resource. Again, some of your questions may have been a little bit more, and I know I went over them, but I'm happy to, if you're getting confused or something, type it in chat. I will try to address it and give you some suggestions as we go along. Step 3 is you're going to have to evaluate what you found. What can you say? How can you summarize it down? Boil it down to something, and then you can repeat it as necessary on the different sites or different resources that we have out there. So we'll take a few minutes here so that you can play and write questions and ask questions as you play, because like I say, I know I did most of the demonstration, and as you play, you may have questions, and please type them in chat. I'm happy to address them and answer them as we go along here. So with that. I will let you work in your group. All right. Hopefully everybody's being able to find some resources and materials that they can use for their question that they did. And also, if you feel that your question's not getting where you want to go, you can always change a question and just play. Because again, really want you to take you this time to at least feel somewhat confident with the resources that we presented, fully realizing that I understand this is a survey and there's a lot of resources and a lot of material covered, but there will be the recording out there and it will be available to you as well. Before I wrap up here, I want to say that please connect with us. We are always looking for new partners, individuals to do it, help you understand what you're doing. We're always there to work with you and understand. We have other trainings throughout the year, and we will always be out there and willing to work and be partners as you go along. So it's definitely a way to go along, and we will definitely be out there and working this in year 5 here, and we look forward to seeing you. And last but not least, if you would like your continuing education or for any reason, please fill out our ECE. You can use the QR code that I've provided here, or your or the or the short URL nnlm.gov / capital LN little lowercase n capital X lowercase z. I do appreciate everybody coming today. If you do have any other questions, I'll stick around for a little while. And it's been a good day for all of us. I hope you are able to use these information and resources as you go along. And we do appreciate everybody coming today. And I will leave this up here for a few more minutes here for people to get on and complete their evaluation.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.